Thank you so much. Thank you this invitation to have speech here, and it's great pleasure for me. I would like to share my presentation, but I noticed that there is the previous presentation there, so it is not yet possible, but I hope that now I can share it. I hope that you can see it.
I can see it.
Yes. So my topic today is multi-professional simulation coaching in palliative care and developing emotional intelligence and situational awareness. First, something about my home. So I'm living in Seinäjoki, which is a city in western part of Finland, and we have 60,000 people here. So we are not so big city at all. And here are also a couple of photos of our campus area, Seinäjoki University of Applied Sciences. So we have quite old buildings, but also newer buildings. First, something background for my study. I think that today professionals of healthcare need, and the amount of people needing palliative care is increasing. And continuous multi-professional development and networking are essential elements of health and social care practice today. And I think so that palliative care is very important part of nursing care and medical care nowadays, focusing on improving the quality of care of seriously ill persons and their families. And I think so that palliative care is appropriate at any stage in serious illnesses. It can be provided as the main goal of care or along with curative treatment. Although the knowledge about palliative care has increased among healthcare professionals, studies, however, show that there is still confusion concerning how to implement this palliative care in practice. And there are challenges. There can occur challenge to communicate transitions concern the importance of how and when the transition to palliative care should be offered and communicated. And how long a person has left to live is a great significance for decision making, caregiving, but also preparation in palliative care. And the challenge is to use interprofessional communication and collaboration to promote understanding and collaborate also the situation across varied care levels. I think so that the main point is that this palliative care increases comfort by lessening pains and controlling symptoms and lessening stress for the patient and family, and it should not be delayed when it is indicated. And I think so that this multi-professional collaboration is very important in this area, meaning that there are professionals with different educational backgrounds and work roles working together and developing their work based on mutual respect and appreciation. And this multi-professional collaboration can take the form of dialogue in which all those participants gather knowledge and perspectives, build networks, and also cross borders together. And this collaboration is not possible without clear but flexible coordination and allocation of roles and responsibilities. And the multi-professional collaboration is a combination of many factors and requires constant and conscious development. But there may be also be some kind of communication difficulties or poor communication among healthcare professionals. And that's why that it is good to use new methods how to teach those people. And simulation-based education is one good way to teach nearly authentic clinical environment safely, and also planning those learning aims and content and setting. And what does this simulation-based education mean? It can be defined as imitation of real-life activity which is based on clearly defined learning aims and implemented in as genuine a context as possible. And it can also occur through various workshops or also full-scale simulations that also allow full immersion. And here in Finland, we use these simulation-based methods so that there are three kinds of stages, like preparing, involving creating a scenario, and then setting learning objectives, assigning learner and observer roles, and briefing those participants. And the second stage is the actual simulation activity. And I think so that the most important part is this third stage, because there all those learners, observers, and facilitators reflect on the situation together. And this debriefing is essential because it includes personal reflection and feedback, and they are very important for profound learning experiences and also professional development. And this simulation-based education can be used to develop more generic competencies, for example, teamwork skills, overall management of patient care and counseling. And it can also build up confidence in collaborative practice and team training. And this simulated learning can also improve both professional competencies and also patient care outcomes. And we have had this kind of project here in South Ostrobothnia, like a development of multi-professional simulation-based education. And there has been 3 levels in the development of multi-professional simulation education. And the aims of this project were threefold. First of those aims was to create a network-like simulated learning environment. And there were 3 partners, and then to develop multi-professional simulation education for medical students and for students representing 2 levels of nursing education. And then also to create a multi-professional simulation-based coaching program for health and social care professionals in small and medium-sized enterprises. And this first sub-project was that kind that there was aim to create a network of simulated learning between South Ostrobothnia Hospital District, Seinäjoki University of Applied Sciences, and also Seinäjoki Vocational Education Center. And then this second project aimed to develop joint multi-professional simulation education for medical students and for students that represent 2 levels of nursing education. And up until now, we have had training conducted once with 2 different groups of nursing students from those 2 education organizations, University of Applied Sciences and also Vocational Education Center. And then we have also had once with 1 group of nursing students from University of Applied Sciences, and then also medical students from Tampere University together. And then I will tell more about this third project because it is mainly developed for this palliative care also. And it was meaning to develop multi-professional simulation coaching concept for small and medium-sized enterprises in the health and social welfare sector in South Ostrobothnia. This was also a project that we got funding from European Social Fund for 3 years. And those SMEs, they are not so big ones. There are staff range from a few to 2,050. And they have difficulties in competing with major change and in keeping up with the new technological solutions and also changing practices and also structural change of health and social services in Finland. And main problem is that we have a lot of older people and there is big lack of care providers. nowadays, but also in future. And that's the big problem, and we will need more staff. And this project was also attempt to respond to these concerns and to local and regional staff's practical and theoretical learning needs. And this project also aimed at improving the quality of training by tailoring it to the specific needs of the participants. And then we conducted a wearable survey using instrument based on systematic literature review and also preliminary assessment of learning needs conducted at those SMEs in spring 2017. And we used questionnaire which contained both quantitative and qualitative items, and it was first used to assess those learning needs in SMEs. And the same instrument was also used to evaluate the effectiveness and usefulness of those interventions at the end of the project. And we had 20 SMEs in the health and social work sector taking part in this study, and those enterprises were mental health and also care of old people enterprises. And the data was collected from those staff members. There were 125 members in both those years, and we used this internet-based software and analyzed by SPSS for Windows 23, and also there were open questions, and they were analyzed by inductive content analysis. And the majority of these respondents in these enterprises were women, and most of them had a vocational qualification or higher education degree in nursing or social care. And we were very satisfied because there was quite high response rate. It was 96, which is very rare in Finland nowadays, these studies. And those respondents reported various theoretical and practical learning needs, and some of those needs were individual and others were associated with the development of the enterprise and the working community, like multi-professional collaboration, company development, and also networking. And those respondents were confident about their ability to recognize different kind of client needs and also support those clients' psychosocial and physical ability to function. But there were various learning needs, like how to identify patients who could benefit from palliative care and how to support a dying patient and his or her family members, and how to provide high quality care based on patients' and relatives' needs. And also those participants reported need to develop their interaction and client counseling skills, like supporting dying patients and also family members, and how to develop situational sensitivity, situational awareness, and emotional intelligence in palliative care. And then they also had learning needs in management of palliative care situations and also management of acute situations during this palliative care, also pain and other problems. And then also they wanted to have education concerning coping with challenging behavior of the dying patient's family members. And then also those people in those enterprises wanted to have this education concerning emotional intelligence and empathy skills. And based on those participant needs, we developed those simulation-based coaching interventions centering around the development of emotional intelligence and situational awareness. And those scenarios and simulation-based education sessions were implemented in 5 enterprises, and they were teacher pair giving those education sessions in those enterprises facilities, and a couple of those situations were also arranged in the school. And it's very important to remember to be compassionate and empathetic caregiver and listen and be there for their patients. And those people in those enterprises say that it is not always so easy to remember that, because those people may be there many years. So there may be too much routines and so on, and it is so that they may forget to be empathic for those people. And it can also be so that being able to identify these distressing factors in their life also may help them to be more comfortable. And they experienced that it was very important to practice to conduct a psychosocial assessment through simulation-based coaching, because it helped this medical team, nurses and doctors and those students to facilitate this healthy patient family understanding of adjustment and coping and support. And practicing communication between the medical team and the patients and family could also help facilitate discussion on the process of maintaining and also enhancing relationships, and also finding meaning in the dying process, and achieving a sense of control while confronting and preparing for death. And this innovative simulation coaching concept based on participants' needs, which evolved as a result of this sub-study. And for the first time in Finland, social and healthcare staff of SMEs gathered together for interactive, action-based and concrete learning sessions. It was really interesting, and also teachers were there. There was like a teacher in nursing care and also teacher in social care together, and we didn't had any experience of that kind of simulation-based education previously, but it was really good way. And this coaching consisted of workshops and also collaborative full-scale simulations involving mannequins and simulation video equipment, also teachers as coaches, acting the part of dying patient or her family member. It was not so easy at all to take this kind of role, because there must be very many kind of things to take account, like different kind of emotions and how to have so deep feeling. It is not so easy to take those roles, but it was really interesting. And this coaching took partly place in projects partners' facilities and partly in the enterprise's own facilities, according to those people's specific needs. And the simulation coaches must carefully study each context and set of learning needs before planning any context and contents. And also the participants form a multi-professional group which enabled benchmarking and peer mentoring or sharing knowledge and experiences. And these coaches were teachers working in pairs, and they might represent the same or different fields or of expertise, but it was good to have the pair, not conduct and not counsel those situations alone. The staff in enterprises offering care for old people participated in simulation coaching designed to influence their attitudes and also theoretical and practical palliative care competence. And these aims were to help these staff recognize clients' physical, psychological, and social palliative care needs, also increase staff's sensitivity and preparedness for holistic care, and practice interaction supporting family members. It was so that one lecturer assumed the role of dying person or family member, and the other teacher was facilitating the simulation process and giving feedback and guiding this feedback discussion. And there were 6 to 10 employees taking part same time, and those people were divided to actors working in pairs and observers instructed to focus on certain areas of the performance. And following this intervention, the participants were asked to evaluate the usefulness of the coaching for their competence development and also the suitability of simulation for learning palliative care. And those responses to the 5 Likert type items and 3 open questions were analyzed using SPSS for Windows 25 and also using inductive content analysis. And this simulation coaching was found to be well suited for learning palliative care because it allowed experiencing near authentic scenarios in a safe and confidential atmosphere, and also it encouraged deep reflection. And it was really nice to have a profound discussion, and it was built on the near scenario and shared action and interaction, and it was appreciated as the most important yield of this coaching. And then these participants had also opportunity to discuss challenging care situation, ethics, and coping in a safe environment. And it was possible to integrate the psychological and spiritual aspects of patient care during feedback discussion. And these participants believe that it was possible to improve quality of life for both the person and their family after simulation-based coaching because they experienced that they had better skills to handle and also recognize different kind of feelings and emotions, and also it was easier to go those situations, and also it was like a good feedback discussion when we had this kind of reflection after these simulation situations. And then this simulation-based coaching could be also considered a form of clinical supervision. And as conclusion, I can say that these results of this study confirm that professionals working in small and medium-sized enterprises find multi-professional simulation-based learning effective and useful in promoting networking and also the exchange of knowledge, skills, and support. And I think so that we need simulation training that is arranged to various professional groups together, because it is possible for individuals to learn things like situational sensitivity and emotional intelligence using this simulation pedagogy and coaching. And it's possible to learn something about group dynamics. And also it is so that the simulation-based education makes it possible to prepare for challenging patient and family situation, for example, ethically or socially challenging situations. And then also coaching staff in small and medium-sized enterprises using this simulation-based education and action-based methods is something quite new and unique regionally and nationally in Finland, and maybe also somewhat international level also. And we experienced that it was excellent way to respond to the learning needs of those target groups in enterprises. And the simulation coaching is starting with the staff members' learning needs. It is also good starting point because then it's also useful for them, and they think about and experience it very useful. And also the simulation-based education can be used like imitating real life as closely as possible and in genuine context as possible. And it is also good that this simulation coaching is holistic, experiential, and action-based way to learn and to develop various competencies. Yeah, it can also increase staff members' confidence in their technical and non-technical skills. And it is possible to practice situational sensitivity and rare situations demanding emotional intelligence in an encouraging atmosphere. And what is new about this project? It is so that we have multi-professional groups taking part in those simulation coaching situations, and those participants have an opportunity to exchange knowledge and experiences in a multi-professional situation. And another new thing is that there is the use of peer mentoring, and professionals from various enterprises share knowledge and promote also each other's learning. And the aim is that all these project activities increase networking also in our region, but this can also happen nationally and internationally. And then to sum up some of these ideas, it's important to develop multi-professional simulation education in palliative care. And the members often have different skills, different educational backgrounds, and different amount of experience. And therefore, it's useful to practice various situations in multi-professional teams. And then it's also possible to know other professionals' range of competence and skills and responsibility. And this simulation-based education is also excellent way of learning together, but also learning from each other and also learning to understand the other professionals' scope of practice. And this simulation education helps participants to better understand different ways of thinking and also combine knowledge and skills in a way that benefit the patients. But thank you.
Well, thank you for that very interesting lecture. We do some simulation between social workers and our medical trainees, our fellows, over communication skills with role modeling patients, and they're like the actors, but not to the extent that you do, and not with actually testing them, not studying it.
Okay.
So yes. This is very good.
Yeah, it has been very nice experience. Yes, thank you.
I don't have a question, but I did want to comment. This is Polly Addison. We really believe that simulation education or any kind of interactive or participative type of training is superior way to learn, very effective, very powerful. And so stay tuned, because at 7 o'clock tonight I go on, and mine is very closely related, Mary. So thank you.
Yeah, good. Thank you so much. Yes, thank you.
But we'll be there.
Good.
It's Melissa. I have a comment as well. It was very, very good as well. And in Canada, we have a program called Pallium Canada, and it's a LEAP, like Learning Essentials for Applied Palliative Care. So we do that. We have in like a multi-team that teaches multi-team, and we do scenarios and things. So that's really awesome that you guys are, like Anne was saying, that you're studying it and showing the outcomes, right? Because we do see that in practicality, but it's nice to see that the research on it.
I think so. It's very important, that also very interesting way to learn and teach. It's challenging also for us as teachers. Thank you.